Where you're born and what languages you speak will soon be recorded when you get a COVID-19 vaccine or test positive to the virus. The move is designed to help the government identify whether specific communities are avoiding the vaccine or are disproportionately affected by the virus. For more, I'm joined by Adele Murdolo, who's the Executive Director at the Multicultural Centre for Women's Health. Thank you so much for your time tonight. Why do you think it's important that information like country of birth and languages spoken at home are collected at the time that people go to get a vaccine?
It's a really important thing. Honestly, if you don't know about something, how can you do anything about it? So data collection is going to really make visible the disparities that there are in getting the vaccine. And we already know that there are health inequities in the health system and that they particularly impact on the migrant community. We know that there are poorer outcomes and poorer access to health services in general. And there's no reason to think that this is going to be any different with the vaccine. So the data collection will really show where there are some gaps, where we could pay a little bit more attention to making sure that good, accurate, trusted information gets out to communities.
Can you understand, though, why some people might be reluctant to hand over this information?
Absolutely understand that because, people often don't really understand what will happen with that information. I think there have been some concerns as well that it will be used against communities to say that they're perhaps doing something wrong if they're not necessarily accessing the vaccine in the same numbers as the rest of the community. But having said all of that, and really wouldn't want to put an additional burden on communities that are already burdened by COVID, I really think that this information will probably do much more good than it would do harm, provided we do use it wisely, provided we frame the reasons why people may not be accessing vaccinations with the reasons why that's happening, and not to blame people on an individual basis for not getting the vaccine.
Yeah, and I asked that because earlier in the pandemic there was so much criticism of state and federal governments in their communication, in particular to migrant communities, where you are there in Melbourne, where particular groups seemed like they were being targeted.
That's absolutely the history of it. And so I think we really need to understand the reasons why people will get vaccinated or not get vaccinated. It'll rest on the type of information they have. It'll rest on the trust that they have in that information. And that's why it's really important not to just have communications sitting on websites, even if it is in languages other than English. That communication about the vaccine or even about COVID, because we still need to have that information about how to prevent transmission, is delivered by trusted bilingual health educators who are from the community themselves, who can have in-depth conversations with people about why they should or shouldn't, have a certain type of health intervention. And I guess really people just need the information so that they can make an informed choice, just like everybody else.
So you're saying there needs to be trusted bilingual community members going out into those communities. Would that be a rather onerous exercise?
It is an onerous exercise, but it's something that is an evidence-based intervention in communities. And it's the thing that we know when it's together with all of the other interventions that we know work, like mass communications, messages from trusted health professionals and even government. But we know that it needs to be complemented within migrant communities with trained bilingual health education so that the message gets out. And I think it is a big undertaking, but it really is the thing that we know works so well in migrant communities.
Are there particular migrant communities that are more sceptical or have more reservations about the vaccine than others?
It's so hard to know because this vaccine is so new and it's a completely new context. But what we do know from research is that there are some groups, not necessarily divided by ethnic group, but by other demographics such as gender. So we know that women aged between 30 and 40 have expressed some hesitancy about the safety of the vaccine. And we know that people more generally who perhaps haven't had access to information in their language, so their English language is not the language that they are able to understand health information in. They're two groups that we really need to focus on to make sure that we provide a more of a tailored approach.
Adele Murdolo, really good to talk to you. Thanks for your time.
Thank you, Karina.